Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about National Children's Dental Health Month, and our special guest is Dr. Monica Grant, the director of the Frederick County Developmental Center and the Children's Dental Program at the Frederick County Health Department. Monica, thank you for joining us.
Thank you for having me, Barbara.
So when should children, or when should parents first start taking care of their children's teeth?
Well, parents can start taking care of their children's teeth before they even have teeth. Here's an interesting fact, Barbara. Children are born without the bacteria that cause cavities. So parents can make sure that they minimize the opportunity for children to pick up that bacteria. And how do they get that? They get the bacteria as a transfer in saliva from a parent to a child or from an adult to a child. And parents do things that are very well-meaning. They test the baby's food to see if it's the right temperature by putting it to their lips and then feeding the baby. Or they want to share a bite of food and they take a spoon and have a spoonful of food and then use that same spoon to feed their baby. Or moms clean off a pacifier by putting it in their own mouths and wiping it off rather than running it under some clean, cool water. And there you go. You've transferred bacteria from an adult to a baby, and that can be the seed, the beginning of the development of cavities.
Wow. Well, what else should parents do to try to improve their children's oral health?
Well, establishing a good routine for taking care of teeth is really, really important. And there's a couple ways parents can do that. The first really important way is to begin a habit of good oral health before children even have their teeth. They use a washcloth, a soft cloth, to clean their baby's gums. When babies have their teeth first erupt, then they can switch to a toothbrush and use a tiny smear of fluoride toothpaste to be able to clean those teeth twice a day, especially important at bedtime. You don't want your baby to go to bed with bacteria in his mouth. So here's the other thing. You hear a lot about how important it is for babies to not have juice in their bottle. It's really important. So when you lay your baby down at night, do not give your baby a bottle. When you lay your baby down for a nap, don't give your baby a bottle. And when you do give a baby a bottle, it should have milk or water in it. No juice, no soda, no sugary drinks, no punch. Those two very simple rules put kids on the great path to good oral health.
Oh, that's great. So in addition to what can and should be done at home, what about seeing the dentist? When should children have their first dentist visit?
Well, this might surprise some folks, but the American Academy of Pediatric Dentistry, and the American Dental Association all recommend that a child see a dentist at their first birthday, before their first birthday, in fact.
How important is it about the baby teeth? I've heard some parents say, well, they're just going to lose them anyway. What does it matter?
You know, I've heard that too, Barbara, and I want to send a message that baby teeth are really important. Yes, you do lose your baby teeth, and it sort of seems like you're going to get a redo because you're going to get adult teeth after that. But here's some things that baby teeth do that you really need them for. Young children need their baby teeth to be able to chew the good food that parents give them. Chewing that food releases the nutrients, and they get the best benefit from their food. Another really important reason for children to have their teeth and have healthy teeth is the development of speech. When we talk, we use our teeth as a place to brace our tongue. We use our teeth to hold they're a brace for our lips. We make our sounds because we have our teeth and the other parts of our mouth working together. So when children lose their teeth, they lose the ability to develop some of those sounds properly and in the proper sequence. The final reason that I really want to make sure parents understand is losing a baby tooth too early is a big deal. The baby teeth hold the space for a permanent tooth, and without that space, the permanent tooth doesn't have any place to come in. That leads to poor alignment of teeth later in life.
Wow. So what are some of the other hazards or consequences of children's mouths when they're not cared for well?
Really what we think is that you have to assume that if you've got bacteria in your mouth and you've got a good environment for developing cavities, the children are going to get infections in their teeth or in their gums, and that's painful. Painful teeth make it really hard for kids to chew. There again, we have the problem with not getting the nutrients out of their food. It makes it hard for children to speak. They don't want to push their tongues or their lips against their teeth, and they can develop permanent speech problems. And they miss school. They're out of school and they don't have access to the learning environment they need to be in. And really a very sad story is that in Maryland, a child actually died from an infection in his mouth that eventually sped to his brain.
So if children should be seeing a dentist by their first birthday, the dental provider capacity or the number of visits available to parents in Frederick County. I know a few years ago we had quite a long waiting list for children who had medical assistance or no insurance, no dental insurance. Can you tell us what it's like now and maybe some resources for parents who have either medical assistance for their children or have no dental insurance for their children?
I am very happy to talk about that. We are very fortunate in Frederick that there's been a complete change. We've had some community dentists who've started to accept medical assistance, and we've been able to increase capacity in the dental program. And so a parent who has a child who needs to see a dentist, and that family has medical assistance or is uninsured and has low income, has lots of options to have their child seen immediately. So there's a number on your screen. And if parents want to call that number, that's the number for the Frederick County Dental Program, we'd be very happy to set up an appointment for any child who's got medical assistance or is uninsured. And we're also happy to refer to community dentists who accept medical assistance.
Boy, that's great. That's great. That is very good news, that no child should have difficulty finding a dentist in Frederick County, even for children who are covered by medical assistance or have no dental insurance.
That's right, Barbara.
Boy, that's great. So if you had one final message to our viewers, what would that be?
Well, my final message is take care of your child's teeth early. Before your baby has teeth, think about how you're going to care for his teeth. Make sure it's a high priority. Make sure that you've got a dental visit at the first birthday. When you're putting your baby to bed, don't put him to bed with a bottle. When you give your baby a bottle, make sure it's nutritious milk or it's water. And don't share utensils. And moms, don't wipe off the pacifier with your own mouth. Use water to do that. And we are very happy to have families call us at the Frederick County Dental Program. Again, that number is on your screen, and we would look forward to making an appointment for you.
Boy, that's great. Thanks, Monica. Some really good tips, and I think maybe some surprising tips for a lot of our viewers out there. So I hope that what you said will make a difference in people's practices and children's health.
Thanks, Barbara. I hope so too.
Great. Thank you very much. And now please stay tuned for this month's Medical Myths.
Are you looking for that perfect spot for your child's next birthday party? Look no farther. Frederick County Parks and Recreation can fulfill all your birthday party needs. Choose from any of our rec center locations. Your party rental includes tables, chairs, paper products, on-site facility supervisor, and much more. Pricing for our parties is $120 for 2 hours in our rec room or $170 for 2 hours in our rec room and gymnasium. For more information and availability, call 301-600-2936 or visit us on the web at www.recreator.com.
Oh, man.
If you're concerned that there is a party taking place where there's underage drinking or drugs being used, or that you've heard that a party is going to take place, there's a tip line that you can call 24 hours a day, 7 days a week. It's 301-600-1318. And now here's this month's Medical Myths. Welcome back to this month's Medical Myths. This month's Medical Myths is about heart disease and women. The first myth is that more men than women die from heart disease. Well, that is false. While men do tend to develop heart disease earlier in life than women, after menopause, women catch up. In Frederick County in 2010, slightly more women than men died from heart disease. The second myth is that cancer kills more women than heart disease. Well, heart disease flip-flops with cancer every couple of years as the #1 killer of women in Frederick County. And that's comparing deaths from all types of cancer combined to heart disease. The third myth is that if you think you're having a heart attack, you should sit down and see if it goes away, or you should try coughing. That could be a life-threatening mistake. If you think you're having a heart attack, you should dial 911 immediately rather than waiting to see if you feel better. Emergency medical services personnel are equipped to treat or resuscitate you if your heart stops en route. And studies have shown that heart attack patients generally receive faster treatment when they're transported by ambulance and the hospital is anticipating their arrival. The fourth myth is that if you don't feel chest pain, you can't have a heart attack. That is false. Although the most common sign of a heart attack is chest pain or discomfort, it's not always one of the symptoms. It is especially important for women to know that other symptoms might include shortness of breath, nausea, sweating, feeling lightheaded, and/or pain or discomfort in other parts of the body such as the back, stomach, neck, or jaw. Men and women alike can experience the Hollywood-style heart attack with severe chest pain, cold sweat, but women, more often than men, have subtler, less recognizable symptoms such as abdominal pain, achiness in the jaw or back, nausea, and shortness of breath. And another common symptom is unusual tiredness. It's that uncanny feeling of fatigue that a woman just can't put her finger on. And too often, women tend to blow off those symptoms. And they might even mistake it for indigestion or a sign of being out of shape. And that mistaking of the symptoms can be deadly. The final myth for today is that heart disease doesn't affect those who are fit and strong. That's false. Staying fit and active does improve heart health, but doctors can cite many cases in which even the healthiest habits are not enough. Exercise does afford benefits, and fitness reduces the potency of risk factors, but it doesn't eliminate them completely. You can perhaps run marathons, but you still have to have your cholesterol checked and your blood pressure, and you still can't smoke. According to the Centers for Disease Control and Prevention, 40% of Americans are at risk for heart disease because of inactivity. 40% due to inactivity. The percentages of U.S. adults with other key risk factors are obesity at 34% of the population, high blood pressure 31%, cigarette smoking 21%, high cholesterol 16%, and diabetes 10%. But remember, 40% of the population is at risk for heart disease due to inactivity alone. So make sure you get your blood pressure and cholesterol checked regularly and follow Angie Blair's health tips related to vigorous exercise and healthy eating. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. In recognition of February being American Heart Month, this month's tip is about the Million Hearts Initiative. Launched by the U.S. Department of Health and Human Services with several key partners, Million Hearts aims to prevent 1 million heart attacks and strokes over the next 5 years. Heart disease and stroke are two of the leading causes of death in the United States. Million Hearts brings together communities, health systems, nonprofit organizations, federal agencies, and private sector partners from across the country to fight heart disease and stroke. It is focused on two goals: empowering Americans to make healthy choices, such as preventing tobacco use and reducing sodium and trans fat consumption, and improving care for people who do need treatment by encouraging a targeted focus on ABCS, which stands for aspirin for people at risk, blood pressure control, cholesterol management, and smoking cessation. These address the major risk factors for cardiovascular disease and can help to prevent heart attacks and strokes. People of all ages, genders, races, and ethnicities are at risk for heart disease and stroke. However, certain groups, including African Americans, older individuals, and women, are at higher risk than others. The Million Hearts campaign outlines several things that you can do as an individual. Prevent heart disease and stroke in your family by understanding the risks. Get up and get active by exercising for 30 minutes on most days of the week. Know your personal ABCS, appropriate aspirin therapy, blood pressure control, cholesterol control, and smoking cessation. Stay strong by eating a heart-healthy diet that is high in fresh fruits and vegetables and low in sodium, saturated, and trans fats and cholesterol. Take control of your heart health by following your doctor's instructions for medications and treatment. In addition, you can take the American Heart Association's My Life Check. This online tool helps you to understand your current level of cardiovascular health, assess your individual health needs, and take steps to reach your personal health goals. With all of us working together, individuals, families, communities, health providers, and national public and private organizations and businesses, we can meet the goal of preventing 1 million heart attacks and strokes over the next 5 years. Take time today to choose one small thing that you will do to make it a reality. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.